My name is Hannah Walker and I'm a senior at Texas Tech. I will be graduating this month with a bachelor's in university studies with areas of concentration in personal finance, human resource development, and sociology. My capstone thesis addresses the wicked problem of how the diagnosis and treatment of autism differs in countries with socialized medicine or different social customs versus here in America. This particular topic is of interest to me because I am on the autism spectrum. This diagnosis affects me in many ways, primarily in my verbal communication and social skills. The prevalence of autism spectrum disorder has alarmingly increased 600% in the last 2 decades. Recognition of autism has expanded primarily due to the increased awareness of the condition. However, this is not an issue that is limited to Western civilization. Developed nations, including the United States, United Kingdom, and Canada, have conducted the majority of autism research, and although developing nations are seeing an increase in ASD, they remain behind in vital areas of diagnostics, treatments, and documentation. The purpose of this report is to identify diagnostic and treatment practices used throughout the world to address a better understanding of how to assess and treat individuals with autism spectrum disorder. The disciplines discussed that are associated with ASD are sociology, finance, economics, healthcare, and culture. The compilation of research draws a clear parallel between access to healthcare services and the pervasiveness of the diagnosis among the population. Furthermore, countries where there is a stigma associated with autism or their rules for social interactions are vastly different from Western society, have lower incidence of autism, and often unreliable data statistics. In 2016, the Center for Disease Control, Autism and Developmental Disabilities Monitoring reported that approximately 1 in 68 children in the United States have been identified with an autism spectrum disorder. Presently, that number is higher for boys at 1 in 42 and for girls at 1 in 189. Autism spectrum disorder is commonly defined as a neurological condition that impairs functions, primarily in the areas of verbal communication, social interactions, and the ability to synthesize abstract concepts. Successful outcomes for individuals with autism is largely dependent upon early intervention and a wide range of therapeutic options that can improve communication and social abilities. The growing awareness of autism indicators can be one of the vehicles for families and individuals who are affected by this condition to get the help they need. When autism is recognized in early childhood, intervention can contribute significantly to the overall quality of life. On a global scale, the way in which autism is treated is undoubtedly complicated by differing societal norms. For example, what is considered socially impaired is not defined the same in countries with different social customs and rules like Japan or China. There is no documented evidence of differences in the way ASD is expressed in children throughout the world. However, it is possible that varying cultural factors may have an impact on diagnostic practices and prevalence estimates. Additionally, therapeutic treatment can be limited by access to available healthcare services. The issue at hand is further challenged by the changing diagnostic criteria for autism. The diagnostic standards for autism have changed with each revision of the Diagnostic and Statistical Manual. This handbook outlines which symptoms meet the benchmarks for ASD diagnosis, yet there are inconsistencies in diagnosis due to how much we are continuing to learn about autism. According to current diagnostic criteria for ASD, an individual being evaluated must have deficits in both social communication and interaction and restricted repetitive behaviors, interests, and activities. Presently, there are 4 important diagnostic assessments a specialist can conduct if a parent notices early signs of what may be autism in their child. First, there is an autism diagnostic interview, a 45-minute interview with the parents involving a thorough discussion about possible ASD symptoms in their child. Autistic Diagnostic Observation Schedule is another assessment that can be utilized where an individual is observed for 45 minutes as a practitioner looks for or observes ASD symptoms. Thirdly, there is the Bailey or Mullen scales of early learning. Both tests employ 60-minute standardized assessments that evaluate cognitive, language, motor, and as well as other developmental areas. The fourth touchstone is the Vineland Adaptive Behavior Scales, a 45-minute parent interview that provides a measure of adaptive functioning, evaluating the child's ability to be independent and solve problems correlating to the child's age. These assessments are largely based upon outward behaviors and a parent's ability to recognize warning signs. Therefore, varying cultural norms for social behaviors can complicate recognizing the indicators. Additionally, the variances in access and comprehensive medical care can hinder getting accurately assessed. The issue is mired in complexity, but warrants the examination of wicked problem. How does the treatment of autism in America compare to countries with social health or differing social norms? The answer to this wicked problem requires exploration of countries with different healthcare models, with a focus on socialized medicine as well as the prevalence of identifying autism in countries with social norms that are in contrast with what Americans deem acceptable social interactions. The most relevant discipline to this topic is sociology, finance, economics, healthcare, and culture. The ability of a family to afford the considerable cost of ongoing treatment is significantly dependent upon their healthcare plan. There are key questions to explore when researching ASD, including how does the treatment available in America compare to that of other countries with socialized medicine? And equally important is the question of how do those various countries define autism? There are many societies and cultures that do not use the same criteria for diagnosis, primarily due to their social customs and traditions. It is beneficial to research the methods and ways in which various countries diagnose and treat autism. When countries can work together and share information to gain a better understanding of this medical condition, their results will lead to new and possibly more effective ways of treatment. The primary sources of existing research that have been identified pertain to the sociological and cultural disciplines, which will affect how an individual is diagnosed. Additionally, some sources provide compelling statistics on the financial costs incurred with the diagnosis of autism. In the article, researchers track autism rates across the globe. The author discusses the factors that influence the prevalence of autism in various countries. For example, the social stigma associated with having a child with a developmental disability has a profound effect on the prevalence of autism identification. Language and culture have a strong influence on research as well. These factors have also been shown to influence what actual standards countries use to diagnose autism. The statistics available in some countries are greatly misleading, especially in areas where there is poor record keeping and inconsistent tracking of data. The article, Countries with the Highest Rates of Autism, provides a list of countries with the highest incidence of autism diagnosis and a brief explanation of the factors that may contribute to those elevated rates. Additionally, the article discusses how government of those countries listed deem ASD. Some countries do not recognize autism as an official disability. Those countries who recognize the disorder in varying ways extend benefits and social services to its citizens. Global prevalence of autism and other pervasive developmental disorders provides a review of epidemiological surveys of autism around the world. It also aims to consider the possible impact of geographic, cultural, ethnic, and socioeconomic factors on prevalence estimates. The researchers make the case that the increase in prevalence is most likely due to the broadening diagnostic factors, service availability, and awareness. This article is a compilation of dozens of research material and data. Cultural variances impact statistics available. For example, the stigma on those with autism in South Korea is so intense that clinicians will intentionally misdiagnose children with reactive detachment disorder, which is a social withdrawal caused by parental abuse or neglect. The adverse social reaction to ASD is so strong that parents in South Korea would rather have their child diagnosed with a disorder that suggests abuse than an autism diagnosis. Due to stigma, lack of awareness, and poor medical infrastructure, Few autism prevalence studies exist outside the United States, Canada, and the UK. Research data also points out how U.S. states with the strongest autism health and support services tend to also have the highest prevalence of autism. According to the Center for Disease Control and Prevention, the states with highest rates per 10,000 people include Arizona with 121, Missouri with 121, New Jersey with 106. In contrast, areas with fewer services have lower rates, such as Alabama with 60, Arkansas with 69, and Florida with 42. These statistics show a positive correlation between the health and support services offered and the amount of cases there are. Societal norms are a critical factor for diagnosing social disorder. In Korea, the language uses an extensive array of suffixes and denote the relationship between the speaker and the subject. Because of these differences, South Korean children with possible autism have trouble using these social markers. However, Western-based test standards for autism, such as the Autism Diagnostic Observation Schedule, do not allow for this. Another example of the inconsistencies seen is that in South Korea, children making eye contact is not socially appropriate, but lack of eye contact is something that the ADOS considers a symptom of autism. The Autism Society organization provides a collection of documented information pertaining to autism specific to the United States. It prevents statistics on the financial cost of the condition over a person's lifetime. These statistics were gathered from the CDC, Bloomberg.com, and the Bureau of Labor Statistics. Autism services cost U.S. taxpayers $236 to $262 billion annually. The cost of lifelong care could be reduced by 2/3 with early diagnosis and intervention. The U.S. cost of autism over the lifespan of an individual with an intellectual disability is about $2.4 million. The cost is $1.4 million for a person without an intellectual disability. The average cost of educating a student for 1 year is estimated at $12,000. It costs more than $8,600 more per year to educate a student with autism. The direct costs associated with autism include therapy, medication, special education, care programs, and caregivers. The indirect costs include lost productivity and wages from the adult's inability to sometimes hold a job, as well as family members who may take care of them. Most studies on autism have been conducted in developed countries where professional support services, standardized screening, and diagnostic instruments are available. The diagnostic assessments used in these and other developed countries include autism diagnostic interviews, autism diagnostic observation schedules, Vineland adaptive behavior scales, and clinical judgment using the criteria from the Diagnostic and Statistical Manual of Mental Disorders. The behavioral interventions include applied behavioral analysis, developmental, individual difference, relationship-based floor time model, and treatment and education of autistic and related communication handicapped children. While there are no approved standard medications for the treatment of autism, there are various medications that can treat its core symptoms. Autism in Asian countries is more prevalent than once believed. In China, the rates are estimated to be 16.9 out of 10,000 people, compared to Japan's rates, which are estimated to be 161 out of 10,000 people. Diagnostic strategies frequently used in China include Childhood Autism Rating Scale, which rates a child's behavior, characteristics, and abilities against that of the expected developmental growth of a typical child of the same age. The Clancy Autism Behavior Scale is also used. The test contains 14 items that are each rated on 3 levels of frequency: never, occasionally, and often. The Autism Behavior Checklist is utilized as well. This is a 57-item questionnaire designed to be completed by parents or teachers. Another diagnostic tool used in Asian countries is the Checklist for Autism in Toddlers, which screens children between 16 and 30 months of age to assess risk for autism. One of the intervention programs for children with ASD is the HEPONC Society. The organization is a non-government program that provides rehabilitation for preschool aged children in China. The goal is to build on visual learning strengths of children with ASD. School-aged children in China with autism receive education in special schools with other children with mental handicaps. Autism research and treatment in African nations is infrequent and unrepresentative of all African countries, making the prevalence of ASD difficult to estimate. The prevalence of countries in Africa may be underestimated because the reported cases are skewed towards more severe, thus more recognizable cases of autism. Unfortunately, educational and behavioral interventions for childhood autism are largely unavailable, although there is a type of treatment that is also being utilized in countries like those in Africa called the ketogenic diet. The ketogenic diet forces the body to use fat rather than glucose as an energy source, and because of its very restricted carbohydrates and limited proteins, results in metabolic state similar to fasting. A study published in 2003 revealed that some children with autism who were on a periodic ketogenic diet experienced a significant reduction in autistic symptoms. 60% of children who adhered to the diet showed improvement in several parameters in accordance with childhood autism rating scale. There are behavioral and linguistic characteristics that are to be associated with autism that may need to be interpreted differently across varying cultural contexts. Some characteristics may not be considered deviant in some cultures in the same way that they are in some Western cultures. The characteristics of social interaction that need to be viewed with cultural sensitivity are eye contact, use of body postures and gestures, significance of peer relationships, values of empathy or social or emotional reciprocity, and the importance of physical touch and attachment styles. The communication characteristics that need to be viewed with cultural sensitivity are the role of communication, the role of communication partners, need for explicit and literal explanation of rules, abstract language, and the use of spoken language, and expected milestones. Western cultures value eye contact, conversational reciprocity, and tends to be more open to physical contact, while other countries view eye contact as disrespectful, idle chit-chat is viewed as unnecessary, and people keep personal space boundaries. Someone in this type of culture may seem to have autistic traits in America, yet the behaviors in their country are viewed as normal and respectful. If classic autistic markers are thought to be good manners, it's not difficult to understand how cultural nuances can skew a parent from seeking professional diagnosis. Another perspective that needs to be considered when discussing autism around the world is healthcare. Many developed countries have a universal government-run healthcare system In America, healthcare is privatized. People have health insurance through their employers, or in the case of the elderly or the indigent, there are government-subsidized health insurance programs. People with greater financial means often have access to more health care options and treatments available. There seems to be a correlation between countries with the highest rates of autism and a universal healthcare system. 8 of the 10 countries listed in the article, countries with the highest rates of autism, have a single-payer or two-tier healthcare system. Single-payer systems have the government provide insurance for all residents and pays all healthcare expenses, except for co-pays and co-insurance. A two-tier system is when the government provides or mandates catastrophic or minimum insurance coverage for all residents, while allowing the purchase of additional voluntary insurance or fee-for-service care when desired. Japan, the UK, Sweden, and Canada have single-payer systems. Denmark, Australia, and Hong Kong are also featured on the list and have two-tier systems. It is easy to imagine that countries with better access to healthcare are going to have higher rates of autism because parents are more likely to get their child tested as well as receive treatment once they are diagnosed. A similar conclusion was found in Hughes' 2011 article, Researchers Track Down Autism Rates Across the Globe, where states with the best autism health and support services tend to have the highest prevalence of autism, and areas with fewer health options had lower rates. The difference in prevalence rates across the United States is due to the amount and quality of health and support services provided by the state, which causes more parents in those states to be aware of autism, and awareness leads to higher likelihood of a parent to look for symptoms, more likely to get their child tested, leading to more children being diagnosed. The worldwide increase in prevalence of autism is essentially due to the rise in awareness of the disorder. This conclusion is most blatantly proved by combining two sources: list of countries with universal health care and countries with the highest rate of autism. 8 of the 10 countries listed among places with the highest incidence of autism have universal health care in the form of either single payer or two-tier. The difference in prevalence rates across the United States is also due to the various services available for diagnosing and treating autism spectrum disorder. A considerable number of studies on autism have been conducted in developed countries that have the advantage of professional support services, standardized screening, and diagnostic instruments. Less developed countries tend to have lower prevalence rates, usually due to the epidemiological studies based on a review of incomplete medical records, which are often incomplete or non-existent. The diagnostic assessments for the US, UK, and Canada primarily measure a child's symptoms based on interviews, observations, and assessments conducted by trained physicians. Tests used in China and Japan are predominantly scales and questionnaires that can be done by either physician, parent, or teacher. There are behavioral and linguistic characteristics that may be associated with autism that may need to be interpreted different across varying cultural contexts. Different countries have different ways of treating autism. The US, UK, and Canada have early intervention programs that can improve cognition and language skills. Intervention programs for children with ASD in China are sent to a non-government organization that provides rehabilitation for preschool-aged children in China, and school-aged children with autism receive education in special schools with other children with mental handicaps. In Africa, autism intervention is largely unavailable, but they utilize the ketogenic diet, which has shown to improve an autistic child's behavior. It is compelling to learn how various parts of the world diagnose the treatment of autism spectrum disorder. Autism is a growing phenomenon that is not limited to the Western world. By learning how diverse countries diagnose and treat ASD, the research will result in more effective treatment and serve to improve the lives of autistic individuals and their families. Most importantly, the information that is gained concerning autism through study and research can then be shared with developing countries.